Hi, I'm John, and I'm a physical therapist and CEO of Pickle. Throughout my career, I've worked in tons of really crazy jobs in clinic, in startups, in big pharma, in consulting, and beyond. I've learned from hundreds of people little tips and tricks to help you pick and find that dream job. I'm not a recruiter, I'm not a career coach, I'm not even an HR professional. These people are experts, and reach out to them in and out of your networks to learn more and more about how to land that dream job you see in healthcare. I want to go over a resume and a really cool job description submitted by another clinician about a role called implementation manager at a digital EMR company. So first, let's talk about the implementation manager role and use some analogies from clinic that may help us to understand. I like to think of implementation managers as actually the clinical part of the job flow, because patient has already been inbounded, patient's already been scheduled. Now you're actually working to implement your plan of care, right? The contract's been signed, and now as an implementation manager, your job is to help this new company that's using your product actually use it in their workflows and use your tools and use your solution. A lot like trying to get patients to get their treatment plans right and to follow your instructions. So for this role, you'll see we have an anonymized job description from a medical records startup, right? And at first, there's some information about the company itself. There's some clues about what they do at a high level. They have enterprise-grade technology, which means they're either working for big companies or their goal is to get to big companies as customers. They use AI in some sort of way, and they primarily work across health systems. There's also some other information here, which is kind of interesting about they are a team of scientists, creatives, technologists, and clinicians, which kind of makes sense as this is an area of healthcare where you need clinical expertise and you need some creativity and some technological horsepower. So as we get into it, the actual implementation manager role itself, you can start to see what they actually expect of you and if you'd be a good fit for this role, right? And there's a couple key points in here I think that are really, really important to point out. The first point is this idea about being the primary point of contact. In essence, you are the face of the company to your new customer or clinic or whoever you're trying to help them implement this new medical records system. And another thing that's really, really important is they make a big emphasis on this idea of communication skills. And I think this is actually a bit nebulous, which we can dive a bit deeper into. Create software, they test it internally, and they test for most use cases, but it's pretty much impossible to guess every single way a customer would use your software and all the different things that can go wrong. And in addition, most customers aren't necessarily experts in the technology. You're going to have to be able to speak many different languages, in a sense, to help customers understand how to use your product well, because they may be more or less tech savvy, they may be more or less clinically savvy, etc. As we get further into the responsibilities, I think, again, here's that point about primary point of contact, right? You've got to have good customer-facing skills and be able to understand problems and work on solutions and explain them in a way that many people understand. But another big thing here is about ensuring our pilots convert to full enterprise partnerships. What this means is that this implementation manager is going to have a big responsibility to help the sales team. Because as new companies release new software, like this medical records company, it's very unlikely that a big customer will sign them immediately. Rather, what they'll do is they'll do a short-term pilot or tester to test it out, and the company, your company, will work towards giving them a great experience and great value so that they turn it into a big, potentially multi-million-dollar contract. But that multi-million-dollar extended contract is no guarantee. So really, a solid implementation manager is really helpful and really important to turn these short-term customers into long-term customers. And then finally, here's another bit we spoke about earlier, managing project risks and issues, right? As well as contingency plans. Because again, relatively new company, probably relatively new software. You have a general idea of what bugs could arise, but you can't plan for everything. You'll need to be able to work on the fly with this customer, but any problems or challenges that arise, whether they're from the tech itself, maybe the customer's just using it wrong. But again, you're trying to smooth over that customer relationship as they're using your product, so they turn them into a long-term customer. Or, and clinically, patients may come to you Googling different illnesses and Googling different diagnoses and treatments Really, you have to work with them so that they can understand what treatment is right and wrong amongst all the noise to help them get better. To be successful in this role, there's a couple of things that come to mind. You have to be able to implement healthcare technology. I think this is really important because this doesn't necessarily mean that you have to work at a startup before. If you think of clinicians, if your clinic has adopted a new medical record system or a new tool or switched to a different system, and you've helped train other people or train patients to use the new patient intake forms, these are all ways to implement new healthcare technology that you've probably experienced in your time in clinic or the hospital or things like that. Another thing is 3+ years of project management. Now, really, really importantly, the lower you go in the job description, generally speaking, the more nice to have things are. So just because you don't have 3 years of formal project management experience doesn't mean that you necessarily wouldn't be a good fit for this job. In fact, I would say patient management is a lot like project management. In addition, some of the things you do around clinic, like doing a journal club, right, or managing patient care outcomes for your staff, these are all examples of project management that you can talk about in your resume. And finally, Epic is a definite plus. In general, it's good to know, even if you haven't used this tool or product or company before, it's good to know what other alternatives and competitors exist in this space, because if you can use a competitor, you know what the problems are, and you can better understand and tell customers why this solution is better than the previous one. Now let's get into the resume. So here we have an anonymized resume from a physical therapist in Massachusetts who's really interested in this role. You'll see, first off, they started off with an objective. In general, I kind of like starting off with an objective, but it's really important to relate what the objective is to the job description you're applying for, because keep in mind, the person that's reading your resume is going to be probably a hiring manager or an HR person. They will neither be fully technical or maybe even fully clinical. So understanding why you're making the jump to a new role and how you apply is super important. I think kind of this bit about strong passion and leveraging technology, this doesn't really tell me anything about outcomes, right? It's what technology? How did you leverage it? Did you adopt a new EMR in your practice? Did you create a new workflow in your practice? I think it's really important to kind of be as descriptive as you can and as specific as you can. The next thing here is education. In general, entry-level roles, I think education is good to be at the top. But as you get into more experienced roles, it's really going to be about what you did here in your previous employment. So I would actually take this and move this down to the bottom. Because if you think about it, you're going to be judged kind of on your job, not necessarily your degree, which could be a given, right? For this employment section, a couple things pop up. The first thing is I think we could probably cut down these bullet points. I think 3 to 4 bullet points per job of 2 lines is a nice mix between different actions that have been completed and enough space to describe what you've done. But I think it's really, really important to include numbers in this. I did this as measured by this, which led to this, right? Try to use numbers and metrics to show outcomes. The idea behind this statement is pretty good. But what is a high retention rate and why does it matter? Did you have a 90% retention rate that was 20% higher than the industry average? Did your team improve their retention rate by 15% because of the processes you built in? This one, I think documented is probably the key word here. I don't really think this is really important. I think this is a good time to talk about what EMR you used as well, or especially if you've used different EMR tools, right? Because again, this is an EMR company. You kind of want to think about this space really well and through firsthand use, right? Monitoring key metrics. What were the metrics? This is actually a pretty good number, but why is this important here? This is probably extraneous. I think this is going to be assumed that you can leverage technology if you're applying to a technology company. And again, I think this is actually a really great project management bit to add, but again, make it sound more PME if you can. Like, you schedule, did you organize, how many people attended, what was the outcomes, things like that. For the second group, I actually think this is like really important. The fact that you're multilingual, bilingual, right? Because there's always value in being able to speak different languages, especially if you're serving customers who are serving patients of different languages. I think this could probably go to the top and kind of really explain this while adding more metrics. For the bottom, I think in general, a skills and qualification section is pretty helpful. I think this is actually pretty interesting, but I don't really love this title because if you think about it, you're talking about your deep understanding of the industry and its processes, not really talking about your clinical expertise. So I maybe rename this to expertise in healthcare workflows or something like that, right? I think this should probably go to the top. But again, it's the same question I had before, is if you're talking about data and monitoring metrics, what are the metrics? Try to use numbers as much as you can, especially if you're calling yourself data driven. And I'm sure you are, but just think about the lens that the person who's reading this is going to be thinking of this through. I think there's a lot of good stuff in this resume and it's a good starting point. But again, try to add more numbers, try to add more metrics, try to add more proof points, and really use a more data-backed approach, especially considering you're going into the technology space and you're mentioning healthcare data in your resume. I'm John. I'm the CEO of Pickle and a physical therapist. We found over 2,000 of the coolest flexible telehealth and non-clinical roles for clinicians. Check us out at withpickle.com and leave us a comment if you have any questions. And even better, if you want to submit your resume so we can help you out with it. Thank you.